So hello everybody, welcome back. In the comment section there is someone that wrote that they are thinking about what to take and what not to take to hospitals and things like that. So I thought that this video was important to do. So here uh, I am making this video now. First things first, I remind you that I am not a doctor. I am just a teacher. Number two, I remind you that you need to be very, very, very conscious of the fact that everyone is human. That includes doctors. That means that they can have a bad day, and when they do, they make mistakes. And also, they are human. Again, breathe every time that you see anyone who is not an animal and who is not a plant. Think that they are human and they can have a bad day and not tell you about it, and they have a right to have a bad day. Now, that means that you have a right to have bad days, and when you have bad days, you're bound to make mistakes, and anybody is going to make them. And whoever tells you that, oh no, hell no, I'm perfect, and yeah, not happening. At least, unless you're telling me that they are Jesus Christ, oh hell no, they are making mistakes. And also, hell no, they are not God, okay? So no, you're allowed to have a bad day, and when that happens, oh hell, mistakes are being made, including doctors, pharmacists, nurses, and basically everyone. Also, again, they are human, which basically also means that they are assuming that everyone is like them. Every time that you walk into a relationship with somebody that you know or you don't know, you are assuming that they are kind of like you, meaning they are at your same level of intelligence and the same level of knowledge and the same level of skill and things like that, because we do comparisons in our heads all the time. So if you are a doctor, you are assuming that your patient also have basic knowledge of anatomy and things like that. They are not. They are patient for a reason, meaning they have no clue what the hell is going on. Because let's be honest, I haven't met anyone who is researching how the hell our body works, unless they are doctors or unless they are physical trainers and stuff. But people don't care about how their own body works, and they don't do courses on first aid kits and first aid per se, and there is a hell of a lot of misinformation, and there is so many things going on around the fact that you are going to the doctor. So having said all of this, you are responsible for trying to take a course on first aid kit and first aid, because obviously you can have a hell of a lot of gear, but if you don't have any idea how to use it, then what the hell? Because like I said before, I've said this like 1,000 times over, there is even a joke about it on the internet, okay? There are two pictures of two women wearing the same suit. They are supposed to be the same size, and yet one of them looks gorgeous and the other one doesn't look that gorgeous. Why? Well, she explains that in the bottom of the picture. She says, I bought this swimming suit, but that did not come with the body. You know what I mean? So the same thing happens here. You are going to the doctor, and it might be a problem because the doctor might be sending you medicine and stuff, but that doesn't come with the treatment that might actually cure you if you're given the wrong information, or if you're even your head, you're thinking that you have something but you have something else. So let me explain this so that you can try to understand this. Every time that you go into a doctor's office, you fill up forms. You say, I'm taking these I have this kind of medical history, okay? So, is the medical history complete? No. Then what are you supposed to do? Well, the medical history actually should be like 40 questions, but the Pager Nurse channel, actually she has a video on how to fill up the proper medical history and things like that. You need to know that. So I don't know if there is somebody else's video on YouTube, but I have seen that one only. So you might want to take a look at her channel if you want to take first aid things and stuff like that. But I'm going to continue. Things that you are supposed to tell to your doctor, because I am a teacher and I'm trying to put two kids together, the doctor and the patient, because quite frankly, they both look like kids. They have no idea how the hell to interact with each other. I don't know, probably because, like I said, the doctor is thinking, yeah, this patient is supposed to know, and the patient is thinking, yeah, he's kind of got, so he's supposed to know. So yeah, no, neither of them knows, because they're both humans. So stop right now. Number one, you're supposed to tell the doctor if you're taking any kind of herbs or medicines. That is just basic, right? Yeah, and yet people do not tell them. So for example, there are women that go to a doctor and they are like, oh, hell no, I can't be pregnant because I'm taking the pill. Yeah, except for the fact that you started taking supplements to relax and stuff in the night, like valerian or whatever. And again, I'm not a doctor, I'm just telling you how it is. And then you are actually more fertile than anyone, and now you are pregnant. And then you're kind of like, no, I cannot be pregnant. And then the doctor is kind of like, yeah, I believe you because you're taking the pill, but yeah, neither of you remind yourself that, you're taking herbs as well. So if you're taking any kind of herbs, medicines, nutritional supplements, whatever, tell them. And this is included but not limited to if you are taking grapefruit juice, orange juice, and any kind of juice that has a lot of things in it. Let me explain this again. Citric juice is not meant to be taken with medication. Doctors know this, but they assume that patients also know this, and no, they don't. And some doctors don't even know about this, and it's insane, because then some patients will know, but other doctors will know, and then, the information doesn't pass the proper hands and stuff. And then you have the wrong amount of medication, because medications are interacting with each other because of the freaking fact that you are taking grapefruit juice. And you're also taking orange juice and stuff like that. In fact, right now, there are medications that will tell you in the package, do not drink orange juice or grapefruit juice with this medication. Yeah, like in the whole day, because it will interact. Every time that you take citrus things act with medicines, and they can mess up a lot. So you need to tell your doctor this. Yeah, I'm taking grapefruit juice, I'm taking citric juice. You need to tell them. And you also need to have pen and paper, both parties. And here's why. Every time that you have a question, you write it down and then you ask. I don't care if your thing is stupid, because it's not it's not stupid to ask. Do you want me to tell you what really stupid looks like? Yeah, you taking a wrong, diagnose, and then taking the wrong medicine and then coming back forever, in a cycle forever, because you don't tell the doctor what the hell is in your head. See, you're assuming that the doctor will judge you. Yeah, the doctor won't judge you. You will judge him later on, because you might think that the doctor is stupid because you didn't ask the question. So ask. Write it down, because you will also forget. So if you have 20 questions before you get into the consultation, just get there and say, doctor, I have these, and this. Can it be these, and those? Because otherwise, they might forget. You may forget, and the information will be lost. And then misinformation will happen a hell of a lot of times. So again, and once he has said that you are supposed to take this medication, and you go to the pharmacy to pick it up, you need to talk to the pharmacist and ask them if that is your correct medication that you got. a hell, and I do mean a hell of a lot of people get sick because they get the wrong medications, because they don't ask, and because they assume that nobody will make a mistake. Yeah, again, you are dealing with a pharmacist. What is a pharmacist? Yeah, it is a person that studied the pharmacy thing, whatever, but the main point is that he or she is human. Meaning, they can have a bad day. For all you know, they might have bumped into a lot of containers and, they just place them all, according to what they remember, but a mistake can be made. Because somebody bumped into them or whatever, and they were in a hurry. You don't know. So, check and double check. Because here is the deal. In this game that we call life, you only get one avatar. One. You don't get 20, you don't get 2, you don't get more than 1. You get only the one that you have right now. This one. Your body, that's it. You can't change it, you can't replace it. So here is the deal, and I'm going to repeat this. If you make something wrong to your avatar, you're not getting a new one. You can't go and reset the system and then get a new one. You can't go and say, hey, yeah, I forgot, or I'm paying for a new one, or with more time, or whatever. Oh, hell no. So, you need to protect the avatar by asking the right things to the right people, because you are dealing with people. They are bound to make mistakes all the time because they're human, just like you. Hell, for all I know, you can be the pharmacist that is making the mistake. So, double, triple check that the prescription is right, that the amount of the prescription is right. Because, some medicines are 5 milligrams, others are 10, stuff like that. So, ask. And again, just double check, the times that you're supposed to take these or whatever. And, if this medicine, you're supposed to, you can place it in the pill organizers and stuff, and they can get mixed up with other medicines, you might want to take a picture of them. Picture of each medicine, and say the blue one with the name on it. The blue one is this, the red one is this, the black one is this, the white one is this, and the shape and everything, and compare it with your nail. Because if your pills mix up and you don't know which one is one, you have your pictures to take a reference. All of this can save a hell of a lot of lives. Because a hell of a lot of people, especially elderly, they tend to take medicine and they tend not to look at it. They just go like, yeah, I'm taking this and that's it. And then you're kind of like, so what the hell did you take? Yeah, I don't know. And then you have to go to the doctor because you are poisoned, because you overtook medicine and stuff like that. And now you have to go through hell because you overtook medicine and you have no idea what medicines there are. And if you are the daughter of this person, oh hell. Or the son of this person, you might be like, I'm pissed at you. Yeah, now it's too late because now you gotta save them somehow. And you have no idea what the hell because you don't have a picture of the freaking medicine. You don't know because the person might say, I took the blue one. Yeah, but what the hell is a blue one? There are thousands of medicines that are blue. So, no, you need to know which one is what. So, every time that you get prescriptions, before you even bother, delivering into the pill things or whatever, take a freaking picture with the name on it. And put it with your size of your nail. Meaning, you take the picture here and the pill here so that you can know what size is it compared to your nail. Because, if you put it in like with nothing to compare it to, then you don't know the size. So, you need to know all of these things. And that is your responsibility as a patient. That is not responsible the doctor thing. Doctors are humans. And they cannot go to every single patient trying to train them as into how the hell to be a patient. That is your responsibility. And, again, doctors are thinking that you know how to be a patient. And you as a patient are thinking, yeah, the doctors are supposed to tell me. No, they're not. Because if they have 100 people that they have to deal with in one freaking day, try to imagine you being pulled by 100 people in one day. Oh hell, I don't think that most people can handle being pulled by 5 people, let alone 100 during one day. So, no. So again, this is your responsibility. You are supposed to do this. You are supposed to know these things. And like I said, you need to take a look at channels that are specialized in these kind of details and stuff, because, oh hell, there should be videos about how the hell to be a patient. Quite frankly, if I was a doctor, oh hell, I would put like 100 questions before I even bother meeting with any patient, because, quite frankly, you have to assume that people are stupid. It doesn't matter if they are, the smartest people in the room. People are stupid because we're people. I don't care if you're Einstein. I don't care if you're a teacher like me. We are all stupid, and I do mean me. We are all stupid, all of us. Why? Because we all have bad days. And every time that you have a bad day, you will say something that you're not supposed to say. You will do something that you're not supposed to do. You will be, not doing something that you are supposed to be doing. You are, it's just insane, because your energy level will be very, very low. And at the same time, you're kind of like not in your own head. So for all you know, at this point, you might be sending emails to the wrong person. You might be sending text messages to the wrong person. You might be, posting things that you're not supposed to be posting because they were private and stuff. And you will be making a hell of a lot of mistakes because you're human and you're having a bad day. And that will happen to absolutely every single person on this planet. There is no way in hell that you're going to go to be human without having a bad day. It's just not happening unless you're Jesus Christ or something like that, and you're not Jesus. So let's get over it. Let's get over that. You might be Christian like me, but you're not Jesus. And you're not God. And thank God that you're not God, because otherwise you will be in a hell of a lot of more trouble. So, like I said, breathe and answer a hell of a lot of questions and learn how the hell to become a good patient. Now, next question. What the hell do you take? And what the hell do you not take? And what the hell do you do? Well, here's the deal. Number 1. Try to listen to the freaking local radio station. Why? Well, because if you don't listen to the freaking local radio station, you don't know which way to go that might be faster, It's important. Because if you're in a hurry to try to get to the hospital, and you're taking the highway, and in the highway there was an accident, and you're going to be stuck there for 4 hours, yeah. And on top of that, you don't have anything in your car because, you are you or whatever, and you forgot or something, and then, because you're having a bad day, it's going to get worse. So, hell no. If going to the hospital means that you're already having a bad day, try not to make it worse. Because bad days are like a snowball in a downfall. They will get bigger and bigger and bigger, meaning worse and worse and worse. Mine has been going on for 7 days. 7 days straight in which I haven't slept well. I have been swearing. I have not done anything in my house that I'm supposed to be doing, for cleaning, for doing, for whatever. I'm not doing the things that I'm supposed to be doing in the government account. I'm not doing a hell of a lot of things that I'm supposed to be doing because I'm having a terrible week. Because I'm losing the freaking battle in my head. Because I have a hell of a lot of troubles now. But whatever. Point being that, I'm here trying to tell you that when you're having a bad day, you don't want to make it worse. And if you don't want to make it worse, then try to keep up with the information at least. And I do mean the bare minimum information, meaning I need to get here at the road's clear. Good? Yes, then get there. That's it. Take it, and I do mean take it very, very slowly. We have a saying that, the saying that we have in Spanish translates some things like this. Talk to me very slow, because I am in such a goddamn hurry. At that point, if that person is slowing you down, you might be able to get the information because your head is overwhelmed. And it's like try to think about a glass that is filled with water. And if you drop water like that, you will make a mess. But if the person goes and drops one drop, slowly, you might not overfill and you might not make a mess. So you need to make it slowly and you need to be breathing a hell of a lot of things. That's why I'm not doing anything I haven't done anything for the last week. I don't want to mess up anymore because every time that I do something, I make things worse. So you want to avoid doing things worse. And for that, you need the local radio station, okay, to tell you if the hospital is having problems with water, if the hospital is having problems with power, if the hospital is overwhelmed and they are telling people to go to the other hospital, because once you take a hell of a lot of energy and time trying to get to the freaking hospital, and once you're there, the hospital is like, yeah, we're filled. You're supposed to go to the next hospital, and the next hospital is 4 hours from here, and you don't even have gas in your car. Yeah, kind of like that. So, no. Hell, no. Breathe and do everything as slowly as you can so that you can get it right. Because at this point, if you already have, like I said, a hell of a lot of trouble, because you are having, to deal with the accident or the disease and you're already feeling very bad and very stressed, try to imagine if all of the other things happen at the same time. You will collapse, then you will be fighting with everybody, and then you will be creating a hell of a lot of a mess. So avoid that. Ask the local radio station or pick it up. They will tell every certain time, they will be saying, hey, the hospital is overwhelmed, whatever, and now you know that you're not supposed to go to the hospital but for the other hospital. And now you can save time and you will not be, going through the stress of being there and being turned down. Now, next one. Is about what to take and what not to take. So before I continue with that, I had forgotten, like I said, having a very bad week. I have done these videos for at least, this is like the 5th time that I'm trying to do this video. And I forgot to tell you that my email is down below, so that in case that you want to help me out, you can send an Amazon gift card, so thank you very much. I haven't fixed the problem with the Gomorrah account yet, but I'm going to do that as soon as I can get my head straight. And thank you for, the cooperation, the support, and the comments and everything. So, moving on. What to take, what not to take. Well, number one, I can tell you right now that if your cell phone doesn't have like a belt or something so that you can, attach it to your wrist, you might want to get something like that because you are going to be dropping your cell phone everywhere. And you might want to take it also, that thing, if you can take it to your wrist, you can take it inside your wallet and lock it inside your wallet. Because your cell phone is one of those things that when you're in a hurry, you keep, misplacing and stuff, and it's going to drive you even more crazy. Second thing is the keys. Oh my God, you have no idea how many times people have gone through hospitals and anything, and they keep forgetting the freaking keys. So for example, let's say that you are leaving to your mom's house because she's feeling sick, and now you need to take her to the hospital. Yeah, so you're leaving from your house to your mother's house, and then once you're in your mother's house, your mother can't get up, and who the hell is going to answer the door? How the hell are you going to open the freaking door if your mother cannot move? If your mother is, on the ground or something, how the hell are you going to get inside that thing? Yeah, you forgot the key. So like I said, cell phone, keys. And I do mean keys, plural. As in your house, your mother's house, whatever has a house, the cars, whatever, the office keys, all of the freaking keys. And that you need to put into a belt or something that goes directly into your belly, because that is the second thing that you are going to probably very likely going to miss and misplace. And then you are like, where the hell did I put the key? Because here's the deal. When you're in a hurry and you're afraid, 3 things that you're going to be looking for all the time. The freaking keys, your cell phone, and the freaking wallet with the money and stuff like that. Your documentation and stuff. And you're not going to find it. Because, like I said, going to a hospital is usually bad news and your head is going to be out of the game. Because most people, are just going to be freaking out. And it's bad. So you might want to take a look at that. So, now, having said all that, if you're an organized person and you already have the keys, you already have the cell phones, and you already have, the things, now you might want to take a look at several things. Number 1, if you have history of the patient and stuff like that, you might have a medical file, grab that. If you have a cell phone charger and a kit for going to the hospital, grab that. If you do not have a kit from going to the hospital, you might want to make one. Now, if you are a woman, in that kit, the most important things that you're supposed to get is things for going to the toilet, as in, toilet paper, soap, and stuff like that. But here's the deal, and here is the very, very, very most important thing besides your freaking cell phone and the key. And that is the freaking pee devising thing. And here is why. You're going to a hospital and you're going to pee. Yeah. Do you really want to tell me what the hell happens in bathrooms in the hospitals? Yeah. When there is no water? Yeah. And when there is no power? Yeah. Quite frankly, I don't want to, freak anyone out, but you might even see vomit in the freaking bathrooms. So I'm going to tell you right now that at that time, you're going to be kind of like, oh my God, what the hell? Oh my God, I would rather, why can I not be a man or something and be standing, Because at that point, you're going to be kind of like, do I have to sit there? Oh crap, I would rather pee myself. You're going to be kind of like that. So it is bad. So, oh hell, no. You need the pee devising standing thing. And you need to have at least 2 or 3 in your wallet, in your thing for going, for all I know, you can carry that thing in your car. Because, it's very, 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 very important. I swear to God, oh crap, it's one of those things that oh crap, you will pay anything to get that thing. Especially if you're in that situation. And anyway, so, having said that, you need something for a small mirror for the patient, because if the patient is going to be in the bed, they're not going to have a mirror to look at themselves, and that might cheer them up. Especially, if you like wearing makeup and stuff, you might want to have that small mirror so that you can give them to the patient and have them there. You also want to have foldable chairs in case that, there is nowhere to be sitting, because, come on, you need to sit. And you also might want to have, all of the things that the doctor may ask from you, and the things that the hospital may require if they have no power and if they have, no water. And you also need cash. You also need, your cell phone needs to have a lot of money on it. Because if you require to download data or take pictures or send a file or anything, and there is no Wi-Fi, then you need a very, very good data plan services. And if you don't have money to download things, then you're going to be screwed. So your cell phone needs to have money on it a lot. And if you don't have that option, then you need the cards that have like a number, and then you put the number in the cell phone, and then that thing will recharge us on the phone. I don't know, whatever method you have available, but your freaking phone needs to have a freaking hell of a lot of money. Because usually these places do not have Wi-Fi. And also, usually some of these places, they have very, very bad coverage in the cell phone thing. And so it is important that you may want to have walkie-talkies. Because let's say that you need to go to the cafeteria, and then something happens and they need to talk to you right away, and you are not there. Yeah, that's why you need the walkie-talkie. Also, besides, like I said, the toiletry kit and stuff like that is supposed to bring, towels and stuff. You might want to bring blankets small blankets, and you might want to bring sweaters and stuff because they are cold in the night. For all I know, you can bring inflatable pillows and stuff so that you can try to be as comfortable as possible. Also, at this point, it's very, very, and I do mean very important that you bring things that will help you pass time, like books or sudokus or game things or whatever the hell you have for that you like. And you might have options like a game board, like a board game of some sort, or puzzles. I don't know, whatever it is that you think will help you pass the time, especially if you have to wait with a lot of people. And also, sorry. Also, like I said, you might want to bring a thermos filled with coffee and a thermos filled with hot tea. The preferred tea for these kind of situations is lemongrass, because that one is like the best, chamomile and lemongrass. So you want to have chamomile or lemongrass, or you can bring either, or you can bring both, and I don't know, because the point is that you're taking something hot. And also, like I said, you might want to consider bringing a 72-hour change clothing thing for the two of you, meaning you and the patient, because this is important. You might need to call your neighbor or someone that you really, really trust to tell them that you're not in your house, to keep an eye on your house, to turn on the lights and stuff. And this is important because you always forget until something bad happens, and then you're kind of like, what the hell, I didn't even turn on the light in my house. So you might want to do that. It's very important that you carry flashlights, especially headlights, because if the hospital is overwhelmed and all of a sudden there is a power outage, oh hell, So you need flashlights. And no, your cell phone won't work as a flashlight, because your cell phone is supposed to be used as a cell phone. You can use it as a flashlight during an emergency for a few seconds or a few minutes, but they are not going to substitute a freaking flashlight. So no, you need the freaking flashlights. You also may want to have snacks that are healthy. Healthy kind of snacks that you can eat, and maybe some that are healthy, or something that you need to ask the doctor if the patient can take or something, but the point is that you need food. Because sometimes, food might be something that you can buy, but then again, they might not be taking credit cards or whatever, or they might not have, or the line for getting food might be too long or whatever. There are people that actually even take ice chest for the hospital, because let's say that you are diabetic, and then you can't find medicines that are supposed to be cold, like the insulin, because problems with vaccines and insulin and stuff like that, I have said this before, is there is a power outage. How the hell do you keep these things cold? So you might need ice, and you might need a lot of ice. That's why people will always bring these things, especially once you are there, because the thing is, you can get there and then you can leave to your house to try to bring whatever the hell you're missing. But you might be willing to take this thing right ahead. So like I said, it's very important that you take something for being good, And at this point, you might also want to take an emergency supply things for patients that may be in need of some things. For example, if you know that the hospital might be having to share, beds that are not clean or whatever, you might need new sheets. And this is important. You need clean sheets and stuff, and the hospital might not have them. So you might need disposable bed center things that are like kind of like a diaper thing, but they will absorb anything, and they will also help with allergies that the patient might have and stuff like that. So you might need that. And you may need stuff like I don't know. For example, for me, I need bubblegum, because every time that I'm stressed, I really, really, oh hell, my friends know this. I don't smoke and I don't drink, But oh hell, when I'm stressed, I can eat, oh crap, I can eat like 150 bubble gums in a day, and I will still be kind of like, I'm pissed. So, oh hell, I need bubble gums. So some people are like, yeah, I need candies, and other people are like, oh hell no, I need I need to smoke, and others are kind of like, oh hell no, I need something hot, and then I need something like a drink or something, whatever. I don't know if it is legal and you can have it, in the surroundings or whatever. Try to do that, and you need that because if it helps you, try to get through the day, because sometimes I swear to God, I don't even know what the hell we have inside us that it continues to support us, even though that we don't know what the hell. So it's like you don't even know how the hell you made it through the night. Yeah, kind of like that. Yeah, you need that. So whatever the hell you need, you really, really need that in that time. So if it is, you watching videos or for a comedy channel, or maybe videos that will calm you down, like videos on cats or something, I don't know, whatever it is, just, bring that thing or try to get that thing, download it or whatever, just in case that you don't have Wi-Fi and you don't have enough data. And anyway, so other things that you might want to consider is, certain oils, like essential oils, so that you can try to calm down, like lavender oil or something. You can ask the doctor if that is okay, because some people are allergic, and you might not, you might not be allowed to use those, but sometimes you can. So you might want to use aromatherapy to try to get you through this thing, because quite frankly, hospitals, they smell very, very clean, but sometimes it's just not that available, and you might want to have that, at least for your own skin or something. Like I said, you might want to have clothing and proper shoes and stuff like that, and also food. Obviously, you need water, so I will take 1 gallon of water per person, to take to the hospital, just in case that something happens and you need the water. But I will take a couple of gallons, you and the patient, so that's a couple of gallons of water if you can carry it and you're okay about it. If not, take at least 1 liter per person, so 2 liters, that would be okay. But take water, because quite frankly, and ask the doctor if you can give the person water, because sometimes you can't, or you're not supposed to feed the person water or anything, because otherwise it might create problems, especially if you're having like a blood test or something. So you need to ask the doctor all the freaking time. I do mean all the freaking time. Doctor, can she or he go to the bathroom? Can she or he, do this or that? Because quite frankly, it is one of those things that, like I said, doctor will assume and you will assume the doctor will tell you. So, oh hell no, you gotta ask. And anyway, like I said, pen and paper, oh hell, that is like a must. And also, besides all of these things, if you do not have yet the medical history, like a file thing, you might want to do that, especially with these problems that, like I said, we're having. And so far, that is about it. You take certain things, like you can sit, because here's the deal, you gotta think, how am I going to go to the bathroom? How am I going to eat? How am I going to drink? How am I going to calm down? This one is the most important one, because otherwise you might not do anything. You need to keep an eye on the car, because obviously, bad times means, oh my God, everyone might take your car or whatever. So you need to keep an eye on the car. You need to communicate with other people, walkie-talkies and cell phones, both. You need to, like I said, sit down and, try to rest and stuff. For these, you might need blankets, you might need sheets, you might need pillows, you might need whatever, I don't know. Depends upon, like I said, the situation. You might need to take a look at other things, like while you're here, is there something that you're supposed to be doing? Like picking up someone, or your house, or animals that you have at your house, whatever. You need to have somebody else doing all the things that you were supposed to be doing. And they are not, this is like, yeah, because you forget to tell everyone that you're supposed to be doing this. So no, you need to keep in touch with other people. And also, you might need to create like a group, for a family group, for example, because if you have three brothers or sisters that are talking to you every 20 minutes to ask what the hell happened to your mom or your father or your uncle or whatever, oh hell no, it's better to just have like a group at that time, and you send just one message to everyone. So you might need to do that and say, hey, it's 7:40 p.m. Everything is okay. We're going to sleep, and the doctor said this. We're having to do this or that or whatever. Please take care of this at my house. Please do this. Please, whatever. And also, your questions might not be your sister's questions, or your brother's questions for your mother thing. So you need to know all of that. And at this point, also, you might need proof of documentation that you are who you say you are about this person. Because if this person is all of a suddenly complicated and they require surgery or whatever, the doctor might need someone to sign papers. And if you don't have the legal paper for doing that, oh hell, this can create a hell of a lot of problems, especially if it comes to a psychiatric thing. If this person, the doctor says is a psychiatric thing or whatever, oh hell, then you need legal papers and things like that. And at that time, you really need documentation that says, okay, I'm the daughter, okay, I am, the husband, the wife, whatever. You need documentation, and you need to prove that you are who you say you are. Especially when it comes, like I said, to dealing with psychiatric problems and stuff like that, because the person might say, I don't know this person. Oh hell, that had happened. That has happened like 1,000 times over, especially if the person has been drugged. That happened to someone that I know. This person went there and he said, who the hell is that person? And then, the girl was like, I am your mother. And then, he was like, no, you're not. Yes, I am. No, you're not. So, oh hell, oh crap. And then, oh crap, you have no idea. You have to prove that you are who you say you are. And it's insane because you're like, oh my God, who the hell carries that? Yeah, you should. And like I said, especially when it comes to oh crap, we're dealing with police and stuff. Oh, you have no idea. So you better have proof that if you are the daughter of this person, yeah, I have proof that she's my mother or something. I know it's stupid, but quite frankly, it does happen. And if you are having a terrible day, I can assure you that it will happen because of Murphy's Law. And I'm sorry, but it's just Murphy's Law. It makes me laugh all the time because it makes my days worse and worse and worse. And then something good happens, and then I am kind of like, what the hell? So, but whatever. So, you need documentation for that. And for all I know, you might even need pictures to prove to this person that you are who you say you are, whatever. And it's just one of those things that you might want to keep in mind, because it's kind of like important. And also, you might want to take creams for your body because, being in air conditioner or being in an environment that is not clean or something, it might, hurt your skin and stuff. So it might make you feel better a little bit. So whatever makes you feel a little bit more normal, then try that. Brushing your teeth, comb your hair, stuff like that. It's like, okay, I'm having a terrible day, then go and wash your face, because at least you can wash your face to try to just try, because it doesn't mean that you will do it. It just means that you gotta try, because otherwise you're just going to melt. I swear you will be like, oh my God, earth, please just swallow me and be done with me. Kind of like that. So, oh hell no. And the earth will be like, oh no, I'm spitting you out. So no. You really want to just try to wash your face, try to brush your teeth and comb your hair and do things that, will be normal or whatever. And very important also, you might need to have like I said, something for a prayer. Because some people are faithful, so they might have like a rosary thing, with the beans that you're supposed to be, for doing the rosary thing, whatever, the rosemary thing, I don't know, whatever. Just try to think that you're going to be in stress, and you're going to be, in situations that are very difficult to explain to other people as well. But the thing is that life continues, whether you are ready or not. Life will continue. You can't make the world stop just because you're having a bad day. The world will continue running, you know. Everyone else will continue running. So you gotta try to accept the fact that you are having a bad day, and it is human. Unless you're telling me that you want to be a freaking robot, and then, you know, if you're a robot, then why the hell are you there? You know, then you gotta try to keep in mind that you're human and you're allowed to have a bad day. Hell, you're allowed to have a horrible week, like I've been having, or you're allowed to have even a horrible month. It's just, you know, kind of like that, and it is okay. And, you know, I can tell you these things, and I hope that this is helpful. And I hope that, you know, that whatever it is that you're going through, I really hope that you get the fact that you're human, and you can cry, and you are allowed to scream. You're allowed to just get out there and go to a place and then ask someone, hey, where the hell can I go to scream? Because, you know, I'm just having a hell of a day. Or cry. Because, quite frankly, you know, going to a hospital is one of those things that, you know, will get people a lot. Oh, by the way, I try to get the information on difference between allergies and intolerance, because whatever is your